Hi there, I'm Dr. Jennifer McGowan, pelvic physical therapist and owner of Regenerate Physiotherapy here in Peachtree City, Georgia. And today I have Elise Hattenbach, did I say it right?
Yes.
Um, who is a functional medicine nurse practitioner here with Stat Wellness in Peachtree City. I'm excited to introduce you to her and learn more about her and the services she offers to our area and how to find her. Elise is a Georgia native who has been taking care of patients for over 10 years. She started in functional medicine as a patient, and through her own health journey and working in the hospital, she wanted a role where she could both educate patients more about their bodies and work with them to address the root cause. She enjoys her role at STAT and the part she gets to play in each of her patients' stories. In her spare time, she enjoys traveling, trying new restaurants, hiking, and reading. She got her undergraduate degree from University of South Carolina and then got her doctorate in nurse practitioner degree from Medical College of Georgia in Augusta. Did I get it right? Okay, good.
Yes. Yes, you did.
Um, Great. So I'm gonna just start. If you could start for me, just a little bit more about your background and what inspired you to enter into the health profession, and then we'll go through your journey into functional medicine.
Yeah. So I was always a science nerd, always fascinated by science, how things worked, how the body worked. I remember very vividly like taking an anatomy class in high school and the teacher saying, the human brain is pretty much the only living thing we know about that has the capacity to learn about itself. And that always stuck with me, and I thought it was very interesting. And so, just like that, we have the ability to learn about how our cells do things, how our body functions. So I always knew I was going to be in the healthcare profession, and then zeroed in kind of on nursing, went to undergrad. Didn't realize just how many opportunities nursing has. There's just a lot. There are a lot of options, but really enjoyed going to school. Definitely knew it was where I was supposed to be. And after undergrad, started as a cardiology nurse, which is where I spent my bedside career. So I've actually worked in cardiology up at Emory for about 8 years. Majority of that was night shift, but working with heart failure, heart attacks, heart transplants, interventional cardiology, kind of all the ranges of anything to do with your heart. So learned a lot there. And then during that time, I went back to school, got my doctorate, then became certified as a nurse practitioner, and ended up moving up to New England. Interestingly enough, during that was pandemic times, which we reflect on now, and ended up working in the hospital up there in interventional radiology, which is a role unlike anything I've ever experienced. Really cool to just learn about how like technology is coming along and how we can help people with internal bleeding, chemo and things like that, all from minimally invasive procedures. So I have a lot from like my background as on the medicine conventional side, if you
Yep.
will, before moving into functional medicine.
If you don't mind me asking,
Yeah.
you had shared that you went into functional medicine kind of based off of your own journey. Would you mind sharing a little bit or however much you feel comfortable sharing about that journey?
Yeah. No, I love talking about it because it's just such a passion project of mine. But as I mentioned, I worked night shift for almost 8 years. And when I made the move to be in like the nurse practitioner role, I was now on day shift, was in that role for about a year, thinking my body will adjust. It's going to be fine. I'll get back to a normal routine. Um, and that never happened. I wasn't sleeping, was doing all the things, all the eating right, working out, but realizing I am working out and I'm falling asleep, like while trying to
Mm-hmm.
work out, like just this profound level of fatigue, that wasn't going away.
Mm-hmm.
And so I had heard about STAT. So I was actually a patient at STAT.
Mm-hmm. That's right.
And being a Georgia native, I had heard about it, joined, and kind of didn't really, I'd done a lot of reading, listening to the podcast, and just kind of like, man, I don't know much about this, but I feel like I'm too young to be on sleeping pills. Like knowing if I go to a primary care what's going to happen. And I'm like, I don't buy that this is the answer for me. I think
Mm.
there's something else going on. And so got the first lab draw, went, met with my personal provider and went through all of the lab work line by line and just got there was a sense of relief of like, hey, I'm not crazy. Like something is off. There's something imbalanced here that I need to work on. And just learning about the sheer amount of things that we can check in lab work that give us better insights into like I learned how my body handles stress and it's not well. 8 years of doing night shift did not do my body any good. And, that impacted my eating. It was impacting my sleep wake cycle. It was impacting my energy. So really just kind of learning about all these definitely different view on things, but then also learning about how we move our body to get it functioning optimally and what that looks like. And so really kind of took a deep dive, worked with our health coaches, worked with our dietitian, and like within a few months was sleeping through the night. And when you sleep through the night, you can change the world, I'm convinced. So, and just like the level of healing that came from just sleeping is just unbelievable. So I have a passion for working for sure with healthcare providers, because it just, we're so stressed all the
Yeah.
time, all the time. But so, even in today's world, like business, moms, dads, like anybody you feel like your feet hit the floor and you go till you drop at the end of the day, like that is a stress on your body. And how can we, educate ourselves about how our bodies respond to that, right? And how
Mhm.
we internally deal with that. Um, and then how do we fix it? Yeah.
Yeah, you just touched on like probably all of us not sleeping well. And that is, as a pelvic physical therapist, we talk about all these things about um, sleep because urinary symptoms can start at night for a lot of individuals. I've had people in their 20s, all the way up to 60 and beyond. And we start to say, is it the bladder or is it something else? And sometimes it's the bladder, which is great because then quick results, we're sleeping. But this is where, as a pelvic physical therapist, like, I don't know, there could be something deeper going on. And I think you even said, kind of going back to your story a little bit, you mentioned, even looking at some basic lab work. Do you feel it sounds like you were doing most acute work. So, so then you're seeing probably the extreme of someone who has then had the heart attack, that end of the spectrum.
Right. And I
Okay.
think, yeah, so my work in the hospital was very much like something had happened to bring somebody there, right? Like a heart attack, chest pain, even heart failure that's in a flare, even working in interventional radiology, like something has happened, you have a cyst and we need to place a drain, or, we need to intervene on a tumor and place, dialysis lines. Like it was very much I'm going to say like reactive, like something has happened and now we're reacting to it.
Yeah.
But with my journey at STAT, I mean, that was like the first time I'd ever had, a hemoglobin A1C checked, or somebody's even checked my hormones, like sex hormones, adrenal hormones, like full thyroid panel. And so there was a lot of it that was just so new to me, even as a healthcare provider. I'm like, man, there's just so much to learn here. And I think that really solidified for me of like, I want to get in this. I don't know how to do it, but I want to get in this and be able to give this back to people.
Yeah. And it just seems like thorough, like an A1C, that's not necessarily functional medicine per se.
Yeah.
Although providers will look at it, it's almost just, and so that's what I'll often screen people for when we're in our sessions or ask questions like, when was the last time you had your CBC or metabolic panel? When's the last time you've had your thyroid? And I will tell you, most times people are like, I don't know. I don't even know. Because again, if they get the blood labs drawn, it's after their session with their provider. If there's nothing too abnormal, they don't really even get contacted.
Yeah.
So it's like, I don't know what A1C is, and we don't need to wait till we're a certain age for that. Can you explain more what A1C is for people that are
Yeah,
listening?
so a hemoglobin A1C is a 3-month average of blood sugar. So it tells us kind of how the blood sugar has been over the past 3 months. We, of course, will see it fluctuate. We joke around in the practice sometimes that we really shouldn't check them in January because we've had Halloween, Thanksgiving, Christmas, and New Year's. And so there's a lot of grace given, just because we hope all of our patients do enjoy their holidays to a certain extent. But it does give us a good picture of, what's happened in the past few months. And a lot of times it won't get checked until almost too late, right? Like, okay, now you might be a diabetic, or depending on what primary care you go to, they might check it if there's a strong family history of diabetes. But we know that blood sugar in general, better blood sugar control can decrease like all-cause mortality, right? Because it's one of the big three we see. We see people with type 2 diabetes, high blood pressure, and high cholesterol.
Yeah.
And they do go together. And so by keeping that tighter blood sugar control, we can just decrease a lot of other risk factors in terms of longevity and aging well and things like that.
What's some other, I would say, like you mentioned thyroid. So we'll go into thyroid. What are ways that you screen the health of the thyroid through blood work?
Yeah, so I like to get what we call a full thyroid panel for just about everybody, any new patient. So that's going to be a TSH, thyroid stimulating hormone. Tells us how well your brain is actually talking to your thyroid. T4, free T4 tells us how much free thyroid hormone is in your thyroid that it's actually making, and then free T3, which is how much is actually active and available in the rest of your body. The thyroid is a very picky, high maintenance little gland, but it runs a lot of our body's processes. So when we look at things like metabolism, nutrient deficiencies, gut health, the thyroid can very much be reactive to things going on in it. But also if there's major imbalances, sometimes working on the thyroid a little bit can help with those other processes. And then of course, when we look at inflammation, if there is inflammation on board, we have the ability to check for antibodies, looking for autoimmune processes that could be in a flare. And there's, things we look at from that perspective, really supporting the immune system.
That was helpful. I think, even hear that, just so for people to advocate for themselves too, are we fully looking at the thyroid? Because sometimes people will show me not that I interpret blood work, but they'll just, and this is for me to be like, I don't see this on this test. You might want to ask for this blood work, or maybe we need to find another provider to get a deeper dive into blood work. Kind of switching gears a little bit, because I'm hearing A1C and thyroid, but as a functional medicine provider, can you explain maybe what your initial session is like, and then why do you go down one path of like, ooh, I'm thinking, because clinical reasoning, each person is different, so, and I know it's the root cause of functional medicine, but if you could tell me a little bit more about your session and then how you decide what's your basic blood work that you're doing, what's your thought process? Does that make sense?
Yeah.
Okay.
So before you even come in the door, we send you questionnaires, which sounds very much like, oh, every practice does that. We send a lot of questionnaires. They are not your average new patient questionnaires. And I like to always tell patients, I know you probably spent 20 minutes filling this piece of paper out that you think I didn't read, and that's not true. We read every single one of them. For multiple reasons. One, when you come in the door, I want to talk about what's important to you. Like, what are your health goals? But then it also gets my brain going about, okay, they're experiencing this, so I want to focus on these other symptoms that me as the provider know could be related. And then as a new patient, when you come in, it's a conversation is what it is. which I really love. It's an hour-long conversation. We go through every single body system. So your mental health, your stress level, how is your energy, how is your sleep, what does your gut look like, hormones for both men and women. And then, of course, if there's anything specific in your history, if you've had a traumatic event, if you were hospitalized for whatever reason, I want to know about that. And we also dig into your childhood. Were you a vaginal or C-section delivery? Were you sick a lot as a kid and did maybe some antibiotic use as a child really now is impacting your gut as an adult? We know that that happens. And so those details are all really important.
Mm-hmm.
So it is a long conversation where I get to know you as the patient and, learn more about you. And then really at the end is kind of where we decide from a lab work perspective what we're going to check, right? Because I want to have all the details before I make the lab order.
Yeah.
So it can vary on what we check based on the story that, you as the patient tell. There's a lot of heart history. You've been told you need to be on a statin for years. If that's a big concern, we might focus a lot more on, heart health and cardiac markers for a little bit. If there's a lot of gut issues, we might focus more on nutrients, immune markers, and things like that. If there's a strong history of autoimmune and you tell me you're sick all the time, we might go down the autoimmune route.
Mm-hmm.
And what I love about this field is that there's no wrong way to do this. It's just we have to start somewhere. So even if we start with the gut, we might end up looping back around to hormones or something else.
Mm-hmm.
And that's okay. That's kind of how this is definitely a journey to be on. I think when patients enter into this type of care, it's like, this is a journey. This is a marathon. This is not a sprint. And, as we work to get things back in balance, we might do gut one session and we might do hormones the next, and that's okay.
Mm-hmm. Yeah. We're on a journey. I'm like, this is just the long game. And then we're shifting.
It is the long game.
And I think going back to functional medicine, do you mind explaining what functional medicine is, and then also your training in functional medicine?
Yeah. So functional medicine is root cause approach, right? So if you're tired, if you're having GI issues, if you can't sleep, I want to know why, right? I want to fix the root. I don't just want to give you a sleeping pill as a Band-Aid. Of course, sometimes that's needed, but we want to fix why you're not sleeping. Is it a blood sugar issue? Is it a gut health issue? Is it a hormone imbalance? Like, what else is going on here that we need to fix? So it's a very much treating the root there. And so because of that deeper dive that we get in those new patient appointments, we're able to kind of take that journey with our patients. My specific training has been through STAT. So we literally have, a residency program of training where we learn all about the testing. We kind of go a lot back to the basics, learning anatomy and the physiology of the different organ systems, and then learn a little bit more and take a deeper dive into those systems from a functional medicine standpoint, right? So how the gut and the thyroid and the hormones are all connected. Doing case studies is a big thing that I did so many case studies training, and the other thing about this is it's a constantly growing field. So there's always new things to learn, always, which I love about it.
With functional medicine, I often like to tell people when I'm trying to explain it. So I'm secretly asking you so I know how to explain it to people.
Yes.
It's like a whole body approach. So often when we're going to primary care doctors, it's just really the time that they don't have. And then therefore clinical reasoning with a career in primary care, and not every provider, everyone's different, but then they might refer out to, which I'm sure you do as well, because you're going to pick up on things, but let's refer you to a nephrologist or kidney doc or a urologist, and it's really specific, like This, as a urologist, says I do the bladder and kidneys.
Right.
But if often in the pelvic PT world, we're seeing someone who has interstitial cystitis or painful bladder, a lot of the times for me, there's been some sort of UTI that ignited things. And then, and or both, or constipation or gut health issues are going on with interstitial cystitis or painful bladder syndrome. So again, we're helping from a physical therapist, helping from like a musculoskeletal nerve joint.
Mm.
But it's this like, oh, I've had this gut issue since 10 years. I'm like, whew. And also, I'm not sleeping. And also, hormones. I'm not like having libido, or my cycle is off.
Yeah.
And so I think a lot of times as a pelvic physical therapist, we're able to ask more of these questions about full body systems, like I said earlier, to get
Yeah.
people to where they need to be and know how long they've been having them. Um, so as far as functional medicine, is there different areas in functional medicine, like hormones, or as far as training is concerned?
Um, Yes and no. I feel like it all gets lumped together because exactly what you're saying, the body, like we view whole body. So from a like training perspective, of course, like there was an intentional, like we're going to learn all about hormones for this amount of time. Um, learn about their impact. But then as you're learning about hormones, you also end up learning a little bit about the gut and a little bit about the thyroid and a little bit about the adrenals because they are all connected. So it's hard to kind of segment those little spaces
Yeah,
because
it's all together.
it,
Yeah,
so
connected.
yeah.
Yeah. Do you have a specific type of problem that you like to treat in the functional medicine world?
I do like hormones.
Mhm.
So I really enjoy doing like whether that's sex hormones or adrenals. I really enjoy working with that. And I've really been, I think I've just been learning more as my patients are coming in with things, but the immune health aspect, really learning more about like how toxins are impacting our immune system, how trauma, how blood sugar, like this chronic illness, people that feel like they get sinus infections all the time. Those things I think have just been a lot more interesting as of late for me to really work and dive into. So,
Yeah.
um, but we do see everything.
Yeah. And again,
So,
everything's related.
yes,
Everything's related.
but I do enjoy doing a lot of hormone work for sure.
Um, what do you think? What's some simple yet effective lifestyle changes that people can make to improve their health? I know it depends, but
Yes, it does depend. And I guess I think just from my own story, I'm just so passionate about sleep. Like
yeah,
it is just, and the patients I've had that, like if all we fixed was their sleep within 3 months, but they're sleeping, it is a game changer when you
yeah,
sleep. So focusing in on having a sleep routine, I find that that can be a little bit of a barrier to good sleep. So even if you're not seeing a provider or working with anybody, like having a routine of like, okay, I'm gonna have a 15-minute, 30-minute, whatever you have time for, wind down period where you put the phone away, you turn down the lights, you take a shower, do a skincare routine, read a physical book or a Kindle or whatever that looks like for you, and kind of get your body ready for bed.
hmm
Can really just help from a, stress perspective. Our body, it recovers, it processes thoughts, it digests, it does a lot of things while we sleep. And so having kind of getting it to that space, I think can be really powerful.
I ask, like I said, about sleep.
Yeah.
Um, but what do you think? Because, well, people try and some people get to bed and sometimes they can't. What do you think is a barrier for people to actually set up a sleep hygiene routine? Is it just building a habit, or is there other things at play?
I think it's a habit. I think it's technology. I think it's I think there's also something to be said for age and stage of kids. There's and that's real life. And that's what I tell people, right? Like I can't change your kids.
Yeah.
But what we can do is like help prioritize, like, okay, if you don't have time for a 30-minute wind down routine, can you take a shower with essential oils that are lavender to really just help calm your nervous system? And that's 5 minutes by yourself. Like that still counts,
Yeah.
And so really kind of finding these little ways to incorporate that. Because, life, we go through seasons where sleep is great. We go through seasons where it's not. And so learning about yourself, what really helps you sleep, but also how to kind of get back to that when you go through those seasons where it is harder. But yeah, sleep is a big one. Protein is another one. Always on top of eating enough protein. That's a big one that can really help from an energy, blood sugar balance,
Mhm.
satiety. If you've got appetite, that hangry feeling that
Yeah.
people get in the afternoon.
Yeah.
Yeah, upping protein is another one that is a very easy tool to just start paying attention to.
Those are great. I'm sure I could like ask you 1,000 more
There's a
questions,
lot. There's a whole list, I
which
know.
is why. And so, if someone starts with you, tell me a little bit more. You do the initial evaluation, and then what do follow-up sessions look like?
Yeah, so at the new patient visit, we don't give a ton of interventions. We might talk about some lifestyle things. So whether that's doing electrolytes, maybe it is we need to pay attention to protein. Maybe, there's something we talk about, like finding things to do for you. A lot of women actually will sit here and look at me and they're like, oh, I don't do anything for myself. I'm like,
Yeah.
great, that's your homework.
Yeah.
Like find something. I don't care what it is, and it doesn't have to be for an hour. It can be for 5 minutes. But find something that you actually enjoy doing for you. So we give these very much more lifestyle kind of approach to the new patient visits. Once we get lab work back, we do meet, we go over line by line what everything means. And we'll kind of pick out kind of our top 3 things we're going to work on, because it tends to be like an 8 to 10 page lab report, and not everybody's used to having that many labs back on themselves. So we'll kind of pick and prioritize what we want to work on, and that is also based on like what you as the patient is your health goals, right?
Mhm.
Like I don't want to miss that in the mix of doing things, right? Like I also want to pay attention to what is important to you as the patient. So that follow-up is really where you get nutrition recommendations, if there's more lifestyle things we need to work on, and then supplements as well. So that really comes at that follow-up. Pending what we're working on, kind of guides subsequent follow-ups. Sometimes that can be 3 months. We'll do a few more labs, check back in, see how things are going. But yeah, that kind of just is very patient dependent on what we're working on.
Yeah. That's helpful. Tell me
Yeah.
more about Stat Wellness and the services that are offered. I heard like health coach and some
Yeah.
dietitian. So if you could tell me a little bit more about what Stat Wellness
Sure.
does.
So our approach, as I mentioned, obviously we're root cause medicine. We do focus as providers, even we focus on dietary, lifestyle, um, and supplements. But I always like to say, because we are not anti-medicine, because I think there is a fear around, well, I'm coming in and I'm on all these pills. Are you going to tell me to stop everything? The answer is no. We believe that there is a time and place for conventional medicine. And our goal is to join you on your journey, not
Hmm.
to necessarily derail what you've already done. So we try to kind of meet our patients where we're at with that. Um, Other services, we do have personal training. We are medicine and movement. So we always talk about movement, whether that's, strength training with personal trainers. If you have an injury, the physical therapy side, both pelvic floor, and the orthopedic side as well. We have health coaches, which are like your ultimate cheerleaders, right? They are the people that have the ability to just really make sure like you're doing something like drinking water in the morning. Those little habits that make a big difference, they really come alongside our patients and really help them, keep them accountable. And then we have our dietitian, our nutritionist, who does a great job working with all of our patients that meet with her from a variety of things, from an autoimmune standpoint, from working on macros. We have, with the range of patients we see, there's a lot of different need there, whether we're working on, like I said, autoimmune, if there's a histamine issue, we're really trying to work on that versus hormones, wide range of things. And she's very, very knowledgeable, but also very, kind of, not to oversimplify, sometimes doing dietary eliminations, like let's cut out gluten for 3 months. That can be really hard for people. And so she really can come alongside and help people even just kind of make those changes a little bit more feasible.
Yeah, it's hard. It is hard to take gluten out.
It is.
Sugar, everything. If one wanted to, you mentioned several services with Stat Wellness. Do they need to start with one provider, or let's say someone wanted a dietitian, could they just see that person first, or?
Yeah. So you can see, yes, I am not the gateway into STAT. I also like to say that you don't necessarily have to go through me. If you need the physical therapy side or the personal training, dietitian, health coach, you can book all of those, what we call a la carte, so visits on their own. The health coaches, the dietitian, and myself offer free 15 phone consults. Okay. So if somebody's just interested in hearing more about those various roles, and very obviously specific to, like, if you have questions about how it would look like for you, we're happy to answer those. We do have a membership option that incorporates all three. So it's a year-long contract that has the provider, the nutritionist, and the health coaches together, but not everybody needs all of that. So you can do a la carte as well.
Oh, cool. So just options.
Yes, there's lots of options.
Options with who you want to see.
That's right.
One last question. If there's one piece of advice you could give a person on their health and wellness journey, what would that be?
Man. The little things matter. I think that's my biggest one. So even if it's, I'm drinking more water this week than I was last week, that's a win. I walked twice this week and I didn't walk any last week. Also a win. Like when we talk about doing this type of healthcare, as we mentioned, this is a marathon. It is a journey. It's to create a better life for yourself. So these little things add up over time and they all make a big difference. So just kind of getting in the habit of doing little things like drinking more water, walking more one week than you did the next. I ate a protein heavy snack today. Like that's also a big win. Or I went on vacation and, I enjoyed myself, but also had protein at every meal. Also a win. We celebrate those because it is all about the journey.
That's really great. I like that. Little things.
Little things.
It's hard because we get hard on ourselves.
We do. We get very hard on ourselves. Yes.
It can feel like a big mountain sometimes trying to improve our health when it doesn't necessarily need to be. So, if people listening in or watching this here on our website or social media, if they wanted to find you, how could they find you or Stat Wellness?
So specific to Peachtree City, we, you can always drop by, see the practice. We do have our coffee conversations, event coming up on the first Friday of the month. That's a great way. It's free. So you can just come meet the staff, meet our founders, see the office. If you're just like, hey, I just kind of want to check this place out. Very low stakes situation. But also on our website, statwellness.com, there's a phone number and email address, info@statwellness. Those are great places to start in terms of if you just want to learn more, make a free 15 consult with me or any of the other options that you have to chat with. And all of our patient care specialists who work at the front desks of our office are very knowledgeable about our services and resources, and they truly can answer a lot of questions as well. So definitely worth just calling or shooting us an email. We're happy to get in touch with whoever is interested.
That's great. And these coffee conversations are in Peachtree City, Stat Wellness location. Okay.
Peachtree City, 9:30 to 10:30. Again, it's just a conversation. Bring your coffee. We have coffee. And it's just a great place to come learn about functional medicine, bring questions. Like I said, all of our staff is there, so you can meet us, and our founder and owner is going to be there as well. So she comes down. And yeah, it's very chill. We've really enjoyed them. The ones that we've done so far have been, like I said, just very low stakes, very chill way to get educated and, have some coffee while you're at it.
Yeah, that's great. Well, thank you so much for your time. I really, really appreciate it.
You are so welcome. Always good to chat with you.
Yes. All right. Talk soon.